You're listening to the Quint's podcast.
How much is too much when it comes to data collection? The age-old debate on data privacy has been stirred again, with Prime Minister Narendra Modi launching the Ayushman Bharat Digital Mission on 28 September. Under this, every Indian citizen will be provided with a health ID, which will record every health-related activity of a person, be it a visit to your local pharmacy or to the hospital for a consultation. At present, the Health ID project has been rolled out in a pilot phase to all 6 union territories, and according to official figures, more than 1 lakh health IDs have been created. The centre has clarified that it is voluntary to get a health ID, but the project, even when it was introduced last year in 2020, faced flak from health, technology, and privacy experts since it abysmally failed to address some key data privacy norms in the realms of consent, security, and privacy, the latter being the most pertinent given the fact that India does not yet have a data protection bill. And another crucial point raised on the issue is whether India actually requires a digital health ID system at this moment, given the gaps in the primary and tertiary healthcare sectors across India and the digital divide between urban and rural India. So, why is the centre adamant on pushing this out when the issue of personal privacy and the country's poor public health infrastructure still persist? To understand this, we spoke with Srinivas Kodali, an independent researcher at the Free Software Movement of India. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. The centre, in its announcement for the rollout of the National Digital Health Mission, said that, quote-unquote, citizens will now only be a click away from accessing healthcare facilities, and that longitudinal health records of citizens will now be enabled with their consent. So, if you do participate in this program, what kind of health data will be collected and stored? Basically, your medical history, pharmacy visits, prescriptions, vaccination status, and all past medical appointments. This is how the centre puts it. Imagine that you're no longer hassled with carrying a mountain of medical records and lab results to your nearest health center and can now simply present a card which will have all your information in one place. All of this does sound like the ideal scenario, but at present, it is a distant dream given the range of data privacy and security concerns associated with such a program. The data collected is basically split into personal and non-personal health data, according to the center. Personal data is any data containing detailed information of your health conditions and treatments. Non-personal data is defined as the aggregate health data and anonymized health data, where your personal identifiable information is removed. And according to a report by the Internet Freedom Foundation, which is a digital liberties organization that seeks to ensure technology respects fundamental rights, the definition of the latter, which is non-personal data, is very problematic since it contains significant ambiguities and that it is, quote-unquote, based on an unconstitutional approach. The report further states that non-personal data can also include personal data that is anonymized, which is of serious concern. And there have been various reports of how individuals in the United States have been re-identified through anonymized data. According to a paper by Latanya Sweeney of Carnegie Mellon University, 87% of the US population can be identified based on just 3 values: their zip code, gender, and their date of birth. Now, registration for a health ID under the National Digital Health Mission is voluntary for all parties, patients and doctors. And the centre has highlighted this fact now and again. However, in the Union Territory of Chandigarh, this rule may have been forgotten. According to a caravan report, in December 2020, the Chandigarh local administration reportedly threatened doctors with non-compliance reports if they did not register themselves with their Aadhaar number. Srinivas Kodali speaks on how the National Digital Health Mission interprets consent or authorization and how problematic it is.
The concerns are this, right? Like when you talk about consent, I will look at it as, from my perspective, I'll essentially look for what you call authorization. Like consent's never clearly defined. It's usually just a checkbox that where you check that, okay, I'm giving you permission to do so and so things. But authorization is more specific, where you're required to duly authorize something. There's more informed choice, right? There's informed decision making. When you sign a piece of paper, you essentially tend to read it. That doesn't happen online. And in case of Quint, there seem to be no actual informed decisions that are actually being taking place. A lot of people who shared their Aadhaar got a unique health ID created for them, But in this process, they also consent to sharing their health data within what they call the National Digital Health Ecosystem. See, Health ID is one component of this new entire mission, the National Digital Health Mission. So the mission has a host of databases where the government of India is going to build large health databases from which any doctor, or sorry, any hospital, any IT company, any insurance agent can request your health data, provided you authorize them to, right? Like through an app, something which will be similar to UPI, where you allow transfer of money, you can allow transfer of data. That's the aim that they have. But to reach that, they want to centralize your health data first, right? Like you can only transfer your health data after it gets collected by the government. So this process of collecting your health data is forceful. You don't have a choice not to participate in it. At least that's the experience that most of people had with Aadhaar, where you're forced to get into it first. Then exiting it is not an option. Right now, there is a possibility for people who got their health IDs created to exit from the system. There's actually a provision on NHA or the National Digital Health Mission's website where you can go and delete your health ID. The one, if it was created for you unknowingly, you can actually go get it deleted. But we don't know if this provision will continue, right? Like the Prime Minister clearly said that we are going to give it to everyone, right? And without it, you could essentially look like government or private sector or even insurance agencies denying you healthcare, access to healthcare. That's the serious concern. When you talk about consent and authorization, there will be a lot of forceful coercion for you to start participating in this. And not all of it will be bad. But the larger concern is that you are only looking at what the private sector wants. You're not looking at what kind of harms this will bring to various underprivileged groups and how to ensure that those harms, like how they may be exploited, right? Like if a lot of health data is publicly available for pharma companies who may be experimenting on some of these people, right? Like who may be conducting all sorts of clinical trials. We know that they happen in a regulated environment to a certain extent. But when a lot of this information is publicly available and you don't know what sort of dark economy that it can create if it's not regulated in the right way. So it's important that you have a law first. You essentially ensure there are checks and balances. Without those, you will see similar kind of problems that you have seen with Aadhaar: data leaks, coercion, exclusion, you name it. Now, anything and everything that you have seen with Aadhaar, where every shopkeeper to a banker who keeps asking to Aadhaar, you will face a similar situation with your national health ID within the healthcare ecosystem. And we really have to wait and watch how far these dangers can go.
And the issue of consent came to pass again recently when the center reportedly is already generating health IDs for individuals who avail the COVID-19 vaccine by presenting the Aadhaar card, which alongside your address has the same three values used to identify US citizens in the example we gave earlier. Srinivas Kodali speaks on how linking Aadhaar with the health ID will give more access than just health data.
The plan for usage of an health ID, or rather a digital ID for healthcare, was always there with Aadhaar. You're witnessing a new health ID being created because people fought back against this whole linking process, right? Like during the whole Aadhaar case in the Supreme Court, when people fought back against this government's plans of linking Aadhaar with everything, the Supreme Court essentially ordered that Aadhaar won't be used for linking, or Aadhaar won't be used to share with the private sector. Now, what we are witnessing here is because Aadhaar can't be shared with the private sector for sharing healthcare data, the government has brought a new health ID. But even in this, when you're getting a health ID, there is a process, part of Quint, part of the vaccination process, where if you give your Aadhaar, you can actually get a health ID, right? So they have kind of sneaked in a backdoor to even link Aadhaar with health ID. And according to the Supreme Court orders, if you want to link Aadhaar with anything, you need a law, right? Like to link Aadhaar with PAN, they made amendments to the IT Act to link. You can only use Aadhaar for subsidies. If you need it for something else, there has to be a law. It needs to basically adhere to the proportionality test that the Supreme Court has recognized in the Puttaswamy judgment, where this process needs to be following a certain set of requirements. And having a law and having basic protections are part of those requirements. Now, without any of these, this whole idea of linking Aadhaar or linking health ID with your health data is essentially A, error prone, B, it could cause a lot of exclusion, and there will be a lack of privacy because there's no data protection law as well. Now, this could affect people in different ways, depending upon who you are, whether you are a woman, whether you're a marginalized person from marginalized community, whether you are a transgender person, depending upon who you are, the health ID will affect you differently, the same way as health affects you differently depending upon your demographics, right? Like a child or an adult gets affected differently. So similarly, the consequences of this national health ID without a law, without basic precautions, could mean disasters for a certain section of the population, while it could be really great for another section of population, which is IT savvy, which is tech savvy, which will potentially benefit from this.
The second persistent hiccup in the rollout of the health ID is data security and privacy, or lack thereof. Now, the National Digital Health Mission does applaud itself for its guiding principle of quote-unquote security and privacy by design. However, whenever the issue of data security or privacy is brought up in India, it always boils down to the absence of legislation supporting an individual's right to data privacy and protection. And according to one Internet Freedom Foundation report, the governance framework for the health mission does not even have a strong accountability framework in case a data breach does occur. And the list of health data breaches is enormous, with one of the most significant ones in 2019, when Chinese hackers reportedly stole health records of 68 lakh patients and doctors from a leading healthcare website. And breaches in health privacy are not restricted to cyber criminals, but also extend to our own state governments. An investigation done by Srinivas Kodali in 2018 showed that the Andhra Pradesh government collected thousands of pages of health data on the government-run Anna Sanjivani website. In one instance, the records of a person's name, phone number, details of the medicines that they purchased, and the store that they bought it from were readily available for anyone with an internet connection. So, what if your health data under the National Health ID program does get leaked? What happens then? Srinivas Kodali says that the center's quote-unquote security and privacy by design is only secure by its name. He expands on past data leaks of personal information and how the government has responded to it.
Remember Arogya Setu? There were concerns around this similar to during Arogya Setu, right? Like people were questioning what happens if the data gets breached. So they brought in this policy called the NDHM Data Privacy Policy, the National Digital Health Mission's Health Data Management Policy. It actually came because Arogya Setu was also part of the National Digital Health Mission, right? So even for COVID, in initial days, they kept saying that we followed the NDHM's health data management policy. The Internet Freedom Foundation went to Delhi High Court saying COVID needs its own separate privacy policy. And that's when you had your own private policy for COVID. So there are a lot of policies. There is no law, okay? There was an intention by the Ministry of Health, Family and Healthcare back in 2018 to get a health data privacy law of sorts, which didn't happen. But the concern here is this, right? Like when you keep saying it's privacy by design, it's security by design, they keep saying data with the government will be secure. And if data leaks from a private company or a private hospital, they're not responsible for it. Okay, this has happened with Aadhaar, right? Like government keeps saying we have 13 feet walls. So data with us is secure, but any data that might leak from a private company, we're not responsible for it. But it's the government that's sharing data to these private companies. Even now, part of the National Digital Health Mission, the government will share all of your healthcare data to private IT companies, insurance companies, and private hospitals. Now, if there is a leak in any of these entities, the government's like, okay, we don't have to do anything about it because it's not our headache. But that's not how it works, right? Like when the state, the executive is required to implement the Supreme Court judgments on Puttaswamy, on right to privacy. If there is a breach, it's the executive who is responsible to ensure that what data was leaked and who were affected. They're required to find these people. They're required to inform the people whose data was leaked so that they take precautions. You need to do a host of things to mitigate that breach so that even if there is a potential chance of a harm, like think very dark scenarios, right? Like there's a blood type and healthcare data of a section of population which has been leaked, and there are these people who have rare blood groups and red blood group data, or essentially their blood types or organ type matches with people who need some of this, and there could be a dark market for it where there could be kidnappings around it for kidneys, for eyes. You don't know, right? Like I'm actually painting a very gory picture of this, but it's very likely. It's important that they really take this seriously so that no one's harmed because of any data breaches, right? Like, and this whole idea of that all of your healthcare data needs to be centralized in one giant database itself is flawed. I don't want to share my health data. I'm health conscious. I know about my healthcare. I will share it with my doctor. I have one doctor. I'll go to only the doctor I trust. I don't travel across the country. I don't go to all random hospitals. So I don't need to share my health data with so many different people or different companies, right? So I can make certain informed decisions, and if you educate a lot of people, I think they all can also make these informed decisions. At the end of the day, people being aware of how healthcare functions, how all of this functions, helps them. But what you are witnessing is, instead of education, the government's actually forcing you to start sharing this data with everyone, and is in fact promoting the private companies to start doing the same, right? So this is a giant mess, just because they want to create a data economy, and all those words that they keep on saying, privacy by design, security by design, are meaningless when that entire design, this whole system, is broken.
And the problems around the national health ID system also extend to access to healthcare facilities in India. The COVID-19 pandemic also gave us a glaring image of the faults in India's healthcare system, starting from lack of critical life-saving oxygen to hospital beds, doctors, and readily available healthcare facilities across India. And while the centre has said that everyone will receive a digital health ID, the growing digital divide cutting across states in India says different. According to an Indian Express report, it is also affecting access to COVID-19 vaccines. So, to come back to the question we asked at the start of the episode, why is the centre adamant on pushing out the national health ID system, knowing the glaring realities of health infrastructure and data privacy? Srinivas Kodali weighs in.
We need to spend a lot of money in improving healthcare to provide healthcare to everyone. COVID has shown us the differences or the lack of healthcare infrastructure in the country, right? Like pretty much everyone, from the rich to the poor, were unable to access healthcare because everybody was sick. It clearly showed, I mean, it's an outlier scenario, but it showed us the faults in our healthcare infrastructure. Now, we need to spend a lot of money in improving actual healthcare infrastructure. And the government's like, okay, we don't have this kind of money. So why don't we start monetizing citizens' data to bringing in investments, and some of this investment will be converted to improve healthcare infrastructure. In an ideal scenario, this is great. Like if you can raise money from the private sector and invest in public facilities, but that's not what is happening. The government's essentially saying that we will leave everything to the private sector, including all of this data. Let the private sector raise money using citizens' data. Let them start building more hospitals. Let them do everything else. And even for people below poverty line who can't access healthcare, we will pay their insurance bills, but they still have to go to the private hospitals. Or they can go to government hospitals. They're giving them an option, but they're saying that we won't improve the government hospitals at all. We won't be investing in them at all. So what you are witnessing here is commodification of data, of healthcare data, right? And this is a model that has been set since Aadhaar. This idea that it's going to solve fraud and all of this is like, they were imaginary. It was purely about financial transactions, digital transactions. And we are witnessing those models being applied to healthcare and several other industries. Now, will it solve our healthcare issues? Like when the government's saying this, they're actually comparing it with the National Health Service in the United Kingdom. But the fact is, if you go to UK, you would see that in UK, healthcare is free and accessible for everyone. And it's actually the state, the government of UK, which takes care of everybody's healthcare needs. They are paying the doctors, they are doing everything, right? The NHS service is doing that. Here, the idea that Ayushman Bharat is going to do that is deeply flawed because they claim it's public-private partnership, but the role of government is very limited to start sharing data with the private sector and let the private sector do whatever they want. We don't know where this is going to go. What we need definitely, though, is a lot of investments in actually public healthcare, not private sector, but actually public healthcare. And all of these, we are giving everybody a health card without infrastructure is useless.
Without a data privacy law or adequate framework protecting our most personal details like our health, India's medical records will be the largest vulnerable and valuable chunk of information available across the world. If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.